Worcester County Public Schools. My name is Lauren Williams, and I'm the Coordinator of School Health Services. I work in the Office of Student Services at Central Office, and I'm here to talk to you today about safety practices that will help keep you and your teachers safe during in-person learning during COVID-19. I'm the one talking to you because in the Office of Student Services, I work as an administrative supervisor for your school nurses. Your school nurses are wonderful medical professionals that are in every one of your school buildings. They are so smart and so caring and are really wonderful at keeping you all, your teachers and your students, safe during in-person learning. I work closely with the health department and learn all of the new guidance that we have to keep each other safe during in-person learning. Our goals for this video are to help you all understand how to keep yourselves and your teachers safe. We will talk about some ways that we have been keeping each other safe since we returned to in-person learning in September. And I know some of those things are new and different to us, like wearing a mask or staying 6 feet from our friends. And so it can be hard to remember them. But this training video is to help us all remember to keep them in the front of our minds and to help remember our friends and our teachers to do them all the time.
Hi, I'm Amanda Underkoffler, school nurse with Worcester County Public Schools, and I am also a Worcester County Public School parent. We have some important safety practices that we want to discuss with you that we need to practice each and every day in order to keep our students and staff safe. First and foremost, if you or anyone in your house are feeling sick or have any symptoms that may be COVID-19, even if you think it's just allergies, have your adult at home call your school nurse. It is so important to fill out your symptom screener each and every day and to fill that screener out honestly. No fever. How you feeling today?
I feel fine. I just have a stuffy nose, that's all.
Oh, let's call your school nurse and let her know.
I want to go to school.
You may still be able to go to school. We just need to call her and let her know and talk to her about it. Now, if she says it's okay for you to come to school, make sure you use your device, fill out your symptom screener today and every day, honestly.
Now let's talk about keeping our distance. This is so weird to me, but our germs are all around us even though we can't see them. So for now, we need to stay in our own bubble.
I know how much you like to hug and be close to your friends, but right now, we have to stay 6 feet apart. Remember, stay 6 feet apart.
Wet your hands under water. Wash with soap for 20 seconds. Rinse underwater and then dry your hands. Be sure to turn off the faucet with a paper towel so you don't get your hands dirty after you just cleaned them up.
Last but not least, these masks don't look like much, but they are so important in keeping us safe and healthy this year. And they don't help if you aren't wearing them right. Make sure your mask covers both your nose and mouth because you breathe out of both of them. Don't touch the front of your mask or anywhere on your face because you don't want to put germs there. If you need to fix your mask or take it off for any reason, make sure you use the ear loops like this. When you do take it off, you want to place your mask on a tissue, paper towel, or somewhere safe face down. If you wear glasses, they can help protect your eyes, but they might get foggy. Don't pull your mask down because there are always ways to fix that. Ask your school nurse if you need help.
Oh, that mask looks like it might not stay up all day. Let's get another one.
Here, I'll get my favorite one instead.
No, you wore that one yesterday. I still need to wash it. Here, wear this one instead. We should be washing and drying our cloth masks each time we wear them. The heat of the dryer helps disinfect our mask. If you wear a disposable mask, make sure you wear a new one each day.
Remember that when you're sick, you stay home, wear your mask, wash your hands, and watch your distance at all times. And it's really important that we use all of our safety practices together because no one of them is perfect in and of itself. Each one of them has some things that work really well and it has some holes in it, like a slice of Swiss cheese. And here you see a picture that shows why all our safety protocols can be called the Swiss cheese model, because each slice of Swiss cheese is a safety practice, and each one has a little bit of a hole in it. But when we put all of our slices of Swiss cheese together, we close up those holes and we help keep ourselves safe. So make sure that you're always doing all four of these practices together at all times. When you're sick, stay home, wear your mask, watch your distance, and wash your hands.
So how does COVID-19 spread? When we breathe, talk, cough, sneeze, or sing, we expel tiny droplets that can spread to others when they are close to us. Sometimes you can see these respiratory droplets, and sometimes they are so small that you can't. Respiratory droplets can have germs in them like COVID-19 and can travel as far as 6 feet from your body.
So why do we have to stay 6 feet apart? Well, to keep from being a close contact of someone who is positive for COVID-19. If you are a close contact, then you are more likely to get sick from them, and we want to keep you healthy. A close contact means being within 6 feet of a person for a total of 15 minutes or more within a school day. Now, this is whether you have a mask on or not, and this is not because masks don't work, they're just not perfect. Staying 6 feet apart is also called social distancing or physical distancing. There are some other ways we can be a close contact, even if we're not within 6 feet of someone for that 15 minutes. Direct contact with someone's respiratory droplets, such as being coughed or sneezed on, being hugged or kissed, sharing water bottles, utensils like spoons and forks, lip balm, or other personal items.
So why can't we share materials with our classmates or our teachers? Germs, possibly COVID-19, can also spread from sharing materials. Materials like scissors, glue, paintbrushes, pencils, pens, markers, iPads, electronic devices. If you share those devices or materials and then you touch your face, your eyes, your nose, or your mouth without sanitizing, you can get those germs in your system. Sometimes sharing these items cannot be avoided. If materials do get shared, they have to be sanitized or quarantined between people, and it's important that you always sanitize your hands between use.
Okay, so when we get back to school, some people are going to be wearing more than just a mask. When staff need to be in somebody's 6-foot bubble or clean up after someone who is sick, we add extra protective equipment to keep them from getting sick. So face shields, these are special glasses to protect their eyes from someone's sneezes or coughs. Gloves will protect their hands when changing diapers or cleaning. And gowns, well, these are to cover their clothes so they don't get germs on them when changing diapers or cleaning. See?
You may be eating in your classroom or the cafeteria in small groups. You should always wash your hands before meal times, like lunch or breakfast. Soap and water are best, but hand sanitizer is also good. You should sit facing forward in your seat. Remove your mask properly and place it on a clean napkin or paper towel. When you are eating, please keep conversation to a quiet level. This is because the louder you speak, the more respiratory particles come out of your mouth, so the more chance there is to spread germs. As soon as you finish eating, you should put your mask on properly before getting out of your seat for any reason, such as to use the restroom or throw trash away. You must also mask up before socializing. When you're finished with your mealtime, you should wash or sanitize your hands once again.
Hi, Hi, my name is Ms. Shorts, and I am one of the Chief Academic Officers for Worcester County Public Schools. And I am here to talk with you today about why we are using so many of our distance learning tools when we are back in face-to-face instruction. We know that using iPads, Pear Deck, Classroom apps, Zoom, and other distance learning tools, even when we're in the same Zoom, will let us be more interactive with our classmates and our teachers. We also know that technology allows us to keep a safe distance but still stay connected. We want to keep a welcoming classroom environment for all of our roomies and our Zoomies.
Now I'm going to talk to you guys about what happens if you get sick when you're at home or when you're at school. During this time of learning during the pandemic, we have to be really safe. And if anybody has any symptoms that could be part of COVID-19, we really need you to stay home and have your adult at home call your doctor and see what we should do next. So a lot of the symptoms that we're looking for are having a cough, having a difficulty breathing, losing your sense of taste or smell, also headache, stomach ache, fever. All of these things are part of what could be COVID-like illness. COVID-like illness isn't the same thing as testing positive for COVID, but it's something that lets us know that we need to reach out to our medical doctors and figure out what's going on. If you or one of your classmates or your teacher becomes sick with COVID-like illness, here's what's going to happen. Your school nurse is going to talk with them and let them know that they need to go ahead and head home until they see a medical provider. Your school nurse is also going to find out who was in close contact with them in the last 2 days before they got sick. And your school nurse is going to send home those close contacts until we find out if your friend or your teacher or your classmate is sick with COVID-19. So your school nurse will send home a wonderful note that will help your adult at home communicate with your medical provider. Your school nurse will circle the symptoms that you have or that your teacher has, and it'll let your adult and your medical provider know what you need to be able to return to school. And then we will ask you and your adult to let us know how you're feeling and let us know what your medical provider says. And if you test negative for COVID, or if your medical provider says they don't need to test you for COVID and there's another specific diagnosis that explains why you're not feeling well, then you can return to school. And your close contacts can return to school too. If somebody tests positive for COVID-19, the health department will call the person who is sick or their adult at home and ask them questions about how long they've been feeling sick and who they've been in close contact with. And the health department will ask us at the school to identify close contacts in the classroom or on the bus or at other activities. We'll also notify anybody in the cohort if somebody tests positive. What's a cohort? A cohort is anybody in your classroom, anybody on your school bus, anybody that's been in a group working with you. We'll let you know that someone tested positive, but that you weren't a close contact. Right away, we will notify those close contacts and tell them that they've been in close contact with someone who tested positive for COVID-19. We will let your adult know if you have been in close contact with someone who tested positive. And we'll make sure that we let you know you need to stay out of school for 14 days from the last time you were close with that person who became sick. It's really important for your school nurse to keep health information private. So we will let people know if they've been in close contact with someone who tested positive for COVID-19, but we won't share their name and we won't share any other specifics about the situation. And we also won't share that someone's sick with COVID-19 with people who weren't directly involved, either by being a close contact or by being part of that cohort, be that a classroom or a school bus, because it's really important for us to keep medical information private and only share it with people who need to know to keep them safe. Lots of people wonder why we've gone back and forth from learning in person to distance learning. And there are lots of factors that go into making those decisions. In a school setting, the most important factors to being able to safely learn in person is making sure that everybody understands the safety rules. That's why we've been talking to you today. So we really need to make sure that everybody understands when you're sick, stay home, wear a mask, wash your hands, and watch your distance. And so if we can do all 4 of those very good, we can stay in in-person learning. So we have spent a lot of time training your teachers and now training you and your families about the importance of safe in-person learning using all of these safety protocols. Another big factor is how much sickness is in the community. So we have to also consider how many people in the community are sick and how many of those people are coming into our school buildings.
Be a public health ambassador. This is a call to action for each and every one of us to do our part to keep students, families, and staffs healthy this year. For this to work, everyone must do their part so we can be in school.
All students and all adults need to follow these safety protocols at all times.
Let's support each other. This is different than what we are used to, so we need to help each other stay on track.
If you see something, say something. Your teachers are here to help.
So students, I want to take this opportunity to say thank you. Thank you for pulling us all together, being models to show us all the right things we need to do, and making sure we stay safe and healthy. Looking forward to see you soon.